I'm Farhan Nadeem. I'm second year cardiothoracic surgery fellow at Temple University Hospital. We have 3-month blocks. We have 4 blocks per year, and the rotations are at Fox Chase Cancer Hospital, at Temple University Hospital in cardiac and thoracic, and then we have rotation in pediatric cardiothoracic surgery at Nemours Hospital in Delaware. Cardiac rotation, we have, depending on the track, it will decide how much months you get to spend there. The rotation is usually you're on call every other week, and that would mean that you would have 2 weekends off, and you'll be working on 2 weekends per month. Otherwise, what you get to do over there, it's bread and butter cardiac surgery, plus we have lung transplants. So when you're on call, sometimes you have to cover them, but not always if you have an index case in the morning. So it's a 2-month rotation at Nemours. Basically, you get to see bread and butter congenital cardiac surgery. You get to participate on most of those cases, on actually every case that they do there. And they're fairly busy. The main thing is getting your cardiothoracic numbers depending on your track. So I did not have any problem getting my numbers when I was there. So overall, you get 4 weeks off for vacation. The call schedule on thoracic surgery, you're on call probably once or twice every month, depending upon what you decide with the chief resident who's on thoracic service. Cardiac is a bit different. Cardiac, you're on call every other weekend. So we do have a protected time every week. It's what we have decided for now is after 1 p.m. on Monday, you're free. From 1 to 2, we do have didactics, and we follow the TSRA curriculum that I think most of the programs follow in the country. One of the main strengths is flexibility, and number 2, it's a very high volume center, and we do transplants, so you get to see everything. And then the other thing is that in terms of thoracic surgery, strengths for thoracic surgery, we have minimally invasive thoracic surgery, including robotic surgery, that most programs don't have. So I chose Temple because the cardiac surgery exposure at Temple is excellent. It's both in transplant surgery and it's in general adult cardiac surgery. Also, you get to do your rotations at Nemours, and the good thing about those rotations is that you're not competing with anybody at Nemours. You're the only fellow, and you get to scrub on every single case that they do. So the exposure in cardiac is great. Then in thoracic surgery, the exposure is also excellent because you get to do a lot of benign foregut in addition to bread and butter cancer surgery, and not many programs have those capabilities. And the third thing is the robotic exposure that you have at Temple, and most of the programs around the country don't have that.